The purpose of this podcast is to educate and inform. It is no substitute for professional care by your doctor or your qualified healthcare professional. Never disregard or delay professional medical advice because of something you've heard on this podcast or in any linked material. Guests who speak on this podcast express their own opinions, experience, and conclusions. Dr. Shirley neither endorses nor opposes any particular opinion discussed on this podcast. The views expressed on this podcast have no relation to those of any academic, hospital, practice, institution, or other entity with which Dr. Shirley may be affiliated.
Welcome to Forever Fab, the podcast on fashion, the art of living, and all things beauty. This podcast is curated by Dr. Shirley Madhere, MD, as the definitive source of holistic wellness through beauty.
This week's episode of the Forever Fab podcast is dedicated to wellness at work. And the topic of this week's episode is taking care of business, entrepreneurship in healthcare. This is my interview with Ms. Veronica Sutherland. As an author, hello, Ms. Sutherland. Now, as an author and an entrepreneur, Veronica Sutherland has found her niche and then some. She began her career as a nurse practitioner and now adds public speaker, consultant, coach, teacher, having taught over 1,000 students, and that was years ago, and a thought leader, an innovator to her resume. What hasn't she done? Her book, she's an author, From Scrubs to Success, The Nurse Entrepreneur's Playbook, reached number 3 on the New York Times bestseller list and has led to many more opportunities for her and her growing audience. I'm delighted to have Veronica on the podcast today. She joins us via Streamyard to discuss the business of wellness, healthcare's changing landscape, and how to thrive in changing times. Welcome, Veronica. I understand you are joining me from Thailand. Oh, my goodness.
Yes.
Congratulations on your success. Thank you for becoming a member of the beautiful Forever Fab community. And I am sure after we hear about your incredible story that you will gain an even larger audience. Thank you.
Well, listen, I am grateful and honored to be here. So thank you for having me.
Tell me, so where and when did your career journey begin? Tell me that story.
Well, I actually started out as a registered nurse with my first business. So, I wasn't an advanced degree. I actually started my nursing career as an associate's degree prepared nurse. So I had a bachelor's degree already. Um, and I decided that I wanted to switch to nursing. And so I went to the community college. People go, oh my gosh, like you have to start out at a 4-year. You don't. Even though I already had the 4-year degree, I started out as an associate's degree nurse, and went straight to ICU and learned all the things.
All the things that the intensive care unit will teach you about other people and yourself.
Absolutely. So I worked ICU. I just kind of, I was always the proactive, initiative taker kind of a nurse. And
A go-getter.
Always doing too much,
Yeah.
and not enough at the same time.
Okay, I hear you, sis.
Right. And so I went into critical care nursing, popped around in ICU, did all the things, surgical ICU, trauma ICU, cardiovascular ICU, so med surg ICU. So I did all of those things. And one thing that taught me was time management skills,
Yes.
Right, and the attention to detail, because every little thing, someone could not have a great outcome.
That's right.
And so, then I realized that as part of the healthcare team, nurses were very, very important because we are the boots on the ground, eyes in the scene, telling people what's happening in real time. So I hate the phrase, I'm just a nurse. No, you're not. Like, that's crazy to me because people can't do their job without your input and your critical thinking. So that's where I started. After I left ICU, decided to go to emergency medicine. And so as an ER nurse, is where I really was able to kind of see how what we do shows up in real time in the community. And so there were a bunch of frequent flyers. So those of you who are in nursing, right, you understand what I mean by that. And those are the
Yep.
people who would use the emergency department as their primary
As
care,
a primary
unfortunately.
care. Yep.
And they came in for everything, right? And so I tell people my first business was actually started out of selfishness because I got tired of seeing the same people come in there and backlog my rooms. And I was tired. You're working 12, 14, 16-hour shifts, and here comes, John Doe for the 30th time
Yeah.
because he has a toothache.
Right.
Ari. And so I started talking to those patients and asking, why they're coming so frequently, what's going on in their home environment. Do you not have, other resources that you can tap into? And so after kind of, again, I'm really good at showing nurses how to take their critical thinking and change it to a transferable business skill. So what I just did was a focus group. It was a beta test. I didn't know that's what it was called then.
Right.
But of course, I'm just asking people like, why are you in here again? Like, what are we doing? Like, what are we doing? And then the other part of that was understanding that, hey, like as a taxpayer, my tax dollars are going to take care of you. Like, this isn't the best use of our funds. So, how can I help? And so I have a degree in social work as well. So honestly, I started calling discharge planners in the hospitals like, listen, John Doe's in here for the 30,000th time. What can we do? Da, da, da. I started having conversations with the attendings there and realized that a lot of the people who were frequent flyers coming to the emergency room is just because they didn't have resources or they didn't know where to find them or whatever. So I kind of tapped into that, created my first home care agency, and within 18 months had made $1 million. And I thought, oh my God, I'm onto something.
Wow. And that home care agency was to address the needs of those frequent flyers that were coming through the emergency room, basic services.
Yeah, nothing it wasn't anything that I, recreated the wheel. It literally was just, being a liaison, right? Answering questions, being able to make sure that once you got discharged from the ER, you actually followed up with your primary care doctor. If you didn't have one, let's make that appointment. Let's find those things that can actually keep you in your home environment longer.
Yes.
And safe, right? And then decrease the money that we're spending in healthcare costs because it's all related, and most people weren't thinking that way. This was circa 2000, so most people weren't thinking that way. But yeah, so I didn't have a marketing budget. I was still working in the hospital, right? And so it was kind of a side hustle. I was like, oh, let me see what happens. And literally, I just started talking to docs where I had taken care of their patients who were also at that time, seeing them. In their practices outside of the hospital. So I started getting referrals left and right. Like it was overload.
Yeah.
Because
it was
they
such a
knew,
need.
right. And they knew that I wasn't crazy, right? Like you work with me, you knew my reputation, you knew I'm going to be pretty solid in my, critical thinking skills. I'm not going to do anything that's outside of my scope of practice. And so that relationship that I had built in the hospital, working with those particular physicians and discharge planners, it just made sense, right? And the patients like me, like they would call even when I wasn't working, and they'd be like, where's that nurse? And they're like, well, she's off. And then they would like come in to see me, like not as a patient, but they would come in. And I'd be like, what are you doing here? Like, what's happening?
Yeah. Do you have a splinter in your finger again?
Yeah, that part. And so, so it became, I became the go-to person for all things that were, home care, home health, anything where we could even decrease the length of stay. And it was saving money, right? It was saving money. And so the business side of it, I started like realizing that there's money in this. Like I'm just doing my nursing thing, but there's definitely money in it. And the business model made sense. And so, I opened that first agency, worked it as long as I could before I realized that I had to pick one because I couldn't continue to work in the hospital and do that. Right. I was married. I had a small child. My husband at the time left corporate America, came and worked with me alongside, and we built the business from one location to 6 in the matter of 6 years. So we were doing multi-millions. It was ridiculous. How it was hard work, but it wasn't, I shouldn't say hard. It was challenging, but it wasn't hard.
Right.
And challenging.
And it was gratifying.
Yeah, right. Because we're trying to figure out what's the best way to help patients,
Hmm.
and also, right, help the hospital system, right, while also making a living. So
Of course.
that was a challenge, but yeah, but it was, yeah, like glory days. It was
Days.
good. It was good until it wasn't,
Right.
right?
Understood.
And so I tell people that, businesses, the ebbs and flows, it's just
Yeah.
like everything else.
Of
So you have
course.
to kind of ride the wave and figure it out as you go. Nobody, I don't have a degree in business. Um, and we don't learn how to run a business in medical school, nursing
No.
school. You don't, and so
No.
you have to kind of figure it out. So I made a lot of mistakes.
Hmm.
Um, and learn from that, and listen to people who had done the thing that I wanted to do. What I will pride myself on is I don't listen to people who haven't done what I want to do, like,
Yes.
because you can't help me.
Yes.
And so I learned that very quickly. But yeah, so that's how I got started. That's how I got started. And so, you know, uh, 2008, recession hit.
Hmm.
We had all the things. We had Obamacare. We had,
Yes.
you know, it was just a very tumultuous time. And so for
Yes.
business,
Especially a
we took a
business that provided the services that you did.
yeah, we took a hit. We took a
Yeah.
hit. It was really, really hard. Um, and so I lost everything,
Mm.
right? 2010, filed bankruptcy. I just built my forever home. I
Wow.
had a small child. She was in private school at the time, which was,
Mm.
one of the things that I really wanted to provide my daughter with was a quality education. And
Yeah.
so, you got to understand. So now this is all we have, right?
Right. Right.
So as my husband is working in our business, like our
In the
business is our
business. Yes.
livelihood, that's it. So yeah,
Yes.
so I had to lay him off.
Oh my
We
gosh.
couldn't afford like a
Two executive
CFO,
salaries.
COO salary. It was
Yes.
crazy.
Yes.
Money we weren't getting reimbursed. The government at the time had done their furlough. It was just crazy. Like
Yeah.
we had rental property, and then the real estate market went crazy. So we're stuck with all these mortgages because people are not working. They
Yes.
could pay their rent. So
Right.
it was definitely it was rough. It was rough
Yeah.
for a long time. And
Yes.
so, yeah, I filed bankruptcy. I had 200 employees that I had to end up laying off.
Oh my God.
Um, yeah, 200 people that you have worked with for years. At this
And
point, we
who
probably had
depended
been
on
in.
you.
Absolutely, right? Their
Yeah.
kids, like you saw their kids being born, you saw them, like them sending off their kids to college, and they're buying
Yeah.
houses and all this stuff. So, yeah, 200 people. Like it was
Wow.
crazy.
Yeah, that's pretty tragic.
But I had gone through all my savings, right? So we weren't getting reimbursed from, our payer sources. People were
Yes.
losing their jobs. And even on the private care side of what we were doing, the doctors, lawyers, the engineers, they weren't working. So they could no
Yeah.
longer afford to pay our services as we took care of their elderly parents at home. So it was
Yes.
definitely a vicious cycle. So
Mhm.
yeah, I had to end up filing bankruptcy personally with the business as well. And I went back to work, which is why I tell people that have healthcare licenses,
Mhm.
make sure, if nothing else, like you could have a wonderful business, but make sure
Mhm.
that you're doing what you need to do to keep your license active and valid, because you can
Yes.
always go back to work.
That's right.
Always go back to work.
That's
And
right.
so I did that, right? So I went back to work. I worked as a PRN nurse. I was able to salvage two of the agencies that I had because they were not based on federal funding. They were based on some contracts that I had. So those contracts still, were viable. People go, they were $1 million contracts. I go, yeah, they were $1 million contracts. But if you owe
Yes.
$1,001 at the end of the
That's right.
year, you're still broke.
That's right.
Right.
That's right.
So I was able to kind of keep that floating. I went back
Good.
to school because I knew that I was like, okay, if I can make $1 million, I can do it again.
Yes.
But I needed an advanced degree to be able to do that, to provide more intense services, right? I need to be able to diagnose, treat, and prescribe and get reimbursed for it versus me being a nurse, calling doctors saying, hey, this patient needs an x-ray, this patient needs whatever. And then them, of course, billing for that service. But I
Of
was the one
course.
who actually did the work.
Did the
So
work.
now as an NP, I was like, okay, cool. I can do that myself. And
So you
so
went back
I
to
took
school to become a nurse practitioner.
went back to school, become an NP. I took a position as a consultant,
Yes.
safe patient handling. And so I consulted with hospital systems around the country in regards to changing the culture when it
Yeah.
came to ergonomics, right? With
Mhm.
nursing staff, because again, it's always been about nurses. I'm like, you guys are
Mhm.
getting hurt. You're working 12, 14, 16 hours. You're lifting and pulling on these patients, and then you don't have anything to fall back on. What happens to you? And
Yes.
so I started really getting into ergonomics and training, nurses on how to lift appropriately, writing reports
Yes.
for hospital systems. This is how you can save money on your workers' comp claims. This is how you engage, your staff. And so I was able then to get a lot of the C-suite level experience. That I needed to be able to tap into to run my own business and to go to the next level. So it really worked out. So I spent 3 years.
Yeah, I was going to say you were talking both languages to different ears at the same
hmm
time.
hmm So it was really, really good. So,
Yeah.
talking to CNOs and CMOs, and I'm like, you guys haven't touched a patient in 20 years. You have no idea what it's like, right? Like you have no idea. So
Yeah.
not only as a registered nurse doing direct patient care, but then as a provider taking care of
Yes.
patients, right? And then
Yes.
seeing the business side of it on the C-suite level. So I was able to kind of get experience from all these places. And I did that for 3 years, with no sleep.
Oh,
Yeah.
yeah, believe me, I understand.
Yeah, with no sleep. So yeah, and then still trying to rebuild my life. So I had been married about 20 years at the time. I'm
Yes.
divorced now. And so I
Oh,
tell people,
sorry.
your success will cost you something.
Yeah.
It costs you something. So I talk around the world at this point. I'm in Thailand now. And I
Yes.
speak a lot and I'm telling people, it's going to cost you something. You have to decide what this something is and if you're willing to pay the price for whatever that is. For
Right.
me, unfortunately, it was my marriage. And I tell people all the time, if I could probably do things over,
Hmm.
I would definitely have done things differently. Um,
Understood.
yeah, I said, but I'm happy, right? It's taken me a while to get here. The mental health part of what, as a
Of this
business owner, as an
journey.
entrepreneur, right? I said that it's hard. It was hard. I said, so I've been on antidepressants, I've taken anti-anxiety medications. Um, the holistic approach to
Hmm.
life started with me first, which
Yeah.
is why it's so easy for me to get out here and talk about IV hydration therapy and how it,
Yes.
is a holistic approach to wellness. It's because it worked for me.
Right.
So IV hydration, that became the thing that I ended up teaching nurses about, was because I utilized it for myself, right? I'm very transparent. I tell people, alcoholism runs in my family. So, your one drink would be five for me.
Yeah.
And I couldn't operate like that. And I didn't want to take a chance. And I had to raise my daughter. I said, so I needed to make sure that I was well balanced mentally, physically, spiritually, emotionally, and financially
Of
to be
course.
able to be successful. So here I am now at 50 going, whew, what
Yeah.
it's been a ride, right? It's been a ride. But I love the journey. I
And you're
love the
still
journey.
driving and you're still
I'm
driving.
still driving, still driving.
So
Well,
let's go
actually,
back. Yes.
I don't know if I'm driving here in
Yeah.
Bangkok. There are 10 million people in the city, so I dare not
Yes.
drive.
I know
But
it's a little
but
crazy, but
yeah.
it's very exciting actually. Bangkok. It's
hmm
just so much going on, colors, smells, sights, everything. It's really
Yes.
quite an experience. But let's go
Yeah, for
back a
sure.
little bit and then bring you back to now. So what or who first inspired you to go into nursing or healthcare? And then through all of that, where are you now with what you were thinking back then? Where are you now?
I would. So the who inspired me is the grandmother, right?
Mhm.
So she was 4'10", little feisty little something, right? But she always took care of people. Just
Yeah.
always, just always took care of people, and always seemed to have enough.
Yes.
Whatever enough was.
Whatever it was.
And so yeah, like whatever that is. Like she's the, you know, third grade education, farmed, just a good person who was the person that you would come to if you were sick, would always just knew what to do. So
Mhm.
it's that influence, I think, of course, kind of steered me into wanting to be the people person and take care of people and all that. So I think that's where that started. And my mom's the same way.
Yes.
Um,
But
but I
neither
think it's
of them
probably,
are nurses or were, no. Okay.
nope. My mom worked as a lab tech for 23 years at a hospital.
Wow.
Right?
Yeah.
So she was, she could stick anybody from across
Yeah.
the room in the dark. She
Yeah.
got you. But
Yeah.
yeah, but like born, like, college educated. Mm-mm, no.
Wow.
So I was the
Amazing.
first, college graduate in my family, first millionaire in my family,
Good for
first,
you. Good for
entrepreneur
you.
in my
Great for
family.
you.
But it
Congrats.
comes, it's one of those things where you're like, know that there's more. It's that.
Mm.
It's that you always knew that there was more, right?
You always
People
knew that.
go, Yeah, yeah. Like you always know, like I don't know what I'm doing, but whatever it is, it's going to be big.
Yes.
And big is defined however you want to define it,
However,
right?
okay.
So
Yeah.
yeah. So yes, I knew that. So and then the other part of your question was,
Where are you now and what are you doing now that excites you?
you know, I love being an entrepreneur.
Hmm.
All the things, the ups, the downs, the I get the tingling, like, oh my God, like what's next, right? I
Yeah.
get
Yeah.
that.
Yes.
Um, I love problem solving. I like
Yes.
the coaching part of it. I love being a student. I like
Hmm.
speaking about it. I love when people don't really necessarily understand what they want to do, but they know
Yeah.
they want to do something other than what they're doing. So
Hmm.
that discovery process is amazing. It's very exciting. It's
Yes.
innovative. I like being creative, right?
Yes.
If you can't go to sleep because you keep thinking about this one thing, that's the thing you're supposed to be doing,
Right.
right?
Love it.
So it's I have a lot of different projects, right? So I'm going to be doing more speaking this year. Traveling the globe, still, uh, dipping and dabbling in global entrepreneurship,
Yes.
here, like even in Thailand, right? So there are a lot of things that I want to do, but honestly, I'm just kind of being led by the spirit. I don't
Ah,
really have a plan, right? And I
yes.
never really had a plan. I just kind of go, okay, my faith is very important to me.
Yes.
Um,
And
and
you
so
have
I
faith in
just,
yourself. I would say that that is as big that as your faith in a higher power.
well, the thing is, people know when they're flaky.
Mhm.
Right? People know when they're flaky. Like you know yourself better than anybody else,
Yes.
right?
Yeah.
So you know when you say you're going to do a thing, if you're
Yes.
really going to do that thing,
Yeah.
or if you're
Yeah.
just
Yeah.
talking, right?
Right.
And I know myself pretty well. I haven't always. So the journey for entrepreneurship for me has been self-discovery for sure.
Absolutely.
There's a song by Whitney Houston that said, "I didn't know my own strength."
Hmm.
And that's true. So yeah, you can be creative and fun and create the reality that you want to live in, which is what I've done, right? Everything hasn't been
Yes.
easy. um but I love waking up and being like, what can I create today,
Yes.
right?
That's
I love
pretty
that. Where do
major.
I want to go today? So yeah, so me saying that I wanted to be this global healthcare entrepreneur
Hmm.
started probably 5 years ago, and I was like, oh my God, I wonder what it would be like to have business in other countries. So
Yes.
I went to Dubai. I went to South Africa, right? And started really looking at what healthcare entrepreneurship looks like, or
Looks
nursing
like over
entrepreneurship
there.
specifically looks like in other countries, because there has to be that coalition, right?
Yeah.
So the first time I went to the United Nations back in 2019, I was able really to see the impact that nursing has, just internationally, working with the International Council of Nurses. And so that was
Hmm.
interesting. There were only 40 nurses who had ever, quote unquote, been invited to the UN, and I happened to be one of them.
Wow. That's
And so I
amazing.
was like, right. So you're sitting there, you're like, oh my gosh, like, how did I get here? Um, so you just kind of, do the work, right? I do
Yeah.
the
Just
work
do the thing.
yeah, without the end in mind. Cause
Yeah.
I'm very open. I'm very fluid with how things work. So yeah.
That's fantastic. I loving your story every step of the way. So now so you're in Thailand now, and in Thailand, are you exploring a new business opportunity? Are you creating something new there? Are you there to speak slash consult? What exactly is in the works in Thailand?
So, so this has nothing to do with nursing. I
Perfect,
bought,
because
so
you
when
said
I
you were open.
say, yeah, so when I say that, I'm a healthcare entrepreneur, a
Hmm.
nursing entrepreneur, it doesn't necessarily mean that you should not be well-rounded in
Okay.
other industries.
Okay.
So there are 10 million people in the city of Bangkok.
Yes.
So you want to make sure that whatever business you decide that you're going to invest in, it's something that more people than not will
Hmm.
utilize and or benefit from, and that
Okay.
you're solving a pain point. One of the pain points here is that because there are so many people,
Hmm.
laundry services, right, are
Oh,
needed. So who came
interesting.
over here and bought laundromats? Me.
Okay. Oh my God. And you are cleaning
But
up,
let
I'm
me,
sure.
but let me tell, listen, but let me tell you how it even came about.
How did this
The
come
high,
about?
the high end real estate market here, condos, right?
Mhm.
There's so many people,
Yes.
and most of the condos don't have washers and dryers in
What?
them. No,
Okay.
95% of them do not. They only have a washer,
Okay.
which means that if you have full service laundry services, you
Mhm.
contract with the condos, you do pickups a couple of times a week, full
Mhm.
service. It's included into their rent. So your guaranteed
Wow.
payment. Mhm.
Wow.
And so we basically, because here in Thailand, you can't, as a foreigner, I can't own the business
I
100%.
was just going to
I
ask you,
have
do
to
you
have,
have a Thai partner?
I do. I
Similar
have a
to
Thai
Dubai,
partner.
you can't own the business, but as long as you have an Emirati partner.
Absolutely.
Okay.
Absolutely.
Okay.
So yeah, so I came over, we talked. She actually happened to be, she was introduced to me, and she had some healthcare issues. So we ended up talking about her healthcare issues and the things she could do.
Yeah.
And I was looking at doing some medical tourism
Mm-hmm.
and actually placing minute clinics, right? That
Yes.
model
Yes.
inside of the condos. I happened to be doing
Wow.
some tours. Then I noticed, why are all these clothes sitting around here? Like, because I'm thinking, universal precautions and
Yes.
sanitation and all the things. And I was like, So my little brain got to thinking. And I was
Your
like,
big brain got to thinking.
this makes sense.
Yeah.
And sure enough, yeah. And so sure enough, here we are. It took less than 3 weeks to put the deal together.
Oh my gosh.
Mhm.
And how many laundromats do you have now in these condos?
35.
Oh my God. Oh my goodness. That just
30,
tickles me.
35,
It tickles me
35
pink, and I'm wearing
contracts.
pink. That is fantastic.
And
35
the
contracts.
average,
Each contract
the
is a condo.
average, yep. And the average tenancy in each is 240
Oh my goodness. So 240 times rent. Oh my goodness. Fantastic. And so
times
now
35.
times 35. Yeah. Let's not forget that part.
No,
Congratulations. That's so beautiful.
thank
I
you.
love that you
Thank you.
brought up that just because you're an entrepreneur in a particular field doesn't necessarily mean that you can't open up your mind even further and look at something else, or delve into something else. Or if you want to take a class, and there's classes are now, all of them are online, just to take a peek at what else can motivate you or inspire you. I love that you brought that up.
Absolutely. You have to diversify your portfolio, number
Yes.
one, right? So I've
Yes.
never put all of my eggs in one basket unless I'm the basket,
Yes. Yes.
right?
Yes.
So you look at business models, right? That's what you're looking at. And an astute business person looks at pain points. What is the problem that I can help you solve, right?
Yes.
And what is the likelihood or the vitality of whatever the thing is that you're looking to get involved in? Because I don't do trends,
Yeah.
right?
Doesn't
Trends will
work for
cause
you.
you
Yeah.
to lose a lot of money. No. But I look for things that are going to help communities at large basically stand up.
Yes.
So, so we're looking at people go, oh my God, it's just laundry. I'm like, yeah, but what happens if you have a bunch of dirty laundry laying around?
Yeah.
We're increasing disease. We're looking,
That's
you know
right.
what I mean? So you have to look at all the things. So as a healthcare entrepreneur, it just kind of makes sense. I'm
That's
like,
right.
yeah.
So you look for sustainable solutions to the pain points that most people have, especially region or country specific. Who would have thought that condos in Thailand would not have laundromat? I would have never thought that.
Nope.
Incredible. Incredible.
Nope. And their infrastructure here is amazing.
Really?
It's the little thing. Oh yeah. It's the little things for sure.
Interesting.
Yeah.
You've been listening to part 1 of the Forever Fab podcast with my guest, Veronica Sutherland. Stay tuned for part 2.
Thank you for listening to this week's episode of Forever Fab, the podcast on fashion, the art of living, and all things beauty, curated by Dr. Shirley Madhere, MD. Live beautifully and help make the world a more beautiful place.